Police in South Carolina's Low Country are asking people to keep their doors and windows locked. Workers are laying traps to catch dozens of monkeys that escaped from a research facility last night. CBS News spoke with the company's CEO. Dave Malkoff reports.
The 43 rhesus macaques made a break for it on Wednesday, escaping from the Alpha Genesis Primate Research Center in Yemassee, South Carolina.
The caretaker was doing her normal routine. She failed to secure the doors, and the monkeys basically just bolted through the opening. They're very social monkeys, and they travel in groups. So when the first couple go out the door, the others tend to just follow right along.
So the reason why they got out was literally monkey see, monkey do.
Absolutely.
President and CEO Greg Westergaard says the monkeys, which are used for vaccine development, are hanging out in the woods near the facility. A bystander says he saw the escape, although the video he recorded could not be verified by CBS News.
I think they're having an adventure.
The fugitive primates are described as cat-sized adolescent females.
You want it? You want it?
I met a similar species on assignment in Sri Lanka. In a statement to CBS News, the CDC said the monkeys pose no threat to public health as long as people do not come in contact with them.
Are you a member of the biomedical research community looking for non-human primate products and bioresearch services? Look no further. Alpha Genesis Incorporated has you covered. At Alpha Genesis Incorporated, we're a new class of professionals providing our clients with the highest quality, most cost-effective, prompt and personalized non-human primate research and support services in the industry. We maintain a team of highly skilled professionals who work diligently in the development and execution of a vast range of contract research applications. With more than 100 acres of quarantine, breeding, holding, and research space designed specifically for monkeys, Alpha Genesis Incorporated is one of the largest and most comprehensive non-human primate facilities in the United States. Our large inventory of primates means that research animals are immediately available to our clients for a quick study start. What else could you ask for? Get in touch with us today to learn more.
The World Health Organization has declared a global public health emergency following an outbreak of a new strain of the Mpox virus in Africa. The virus, formerly known as monkeypox, can be passed on through close contact and causes flu-like symptoms and lesions on the body and can be deadly. It's now been detected in at least 13 African countries, but one country has been hit particularly hard, the Democratic Republic of Congo.
Mpox is surging across Africa. And this is ground zero. Thousands of cases have been reported in the Democratic Republic of Congo as a new outbreak grips the country. It's already claimed at least 450 lives, most of them children, and it's showing no sign of slowing down.
The detection and rapid spread of a new clade of Mpox in eastern DRC, its detection in neighboring countries that had not previously reported Mpox, and the potential for further spread within Africa and beyond is very worrying. In addition to other outbreaks of other clades of Mpox in other parts of Africa, it's clear that a coordinated international response is essential to stop these outbreaks and save lives.
Formerly known as monkeypox, Mpox spreads through close contact, including sex, causing flu-like symptoms and painful pus-filled lesions. But this new strain is proving more infectious and even more deadly. And experts fear the growing outbreak in Africa could just be the tip of the iceberg.
We believe that it's already a risk for international spread, and of course, there is also the chance that it could spread beyond Africa to other regions of the world.
The World Health Organization last declared Mpox an international health emergency in 2022, with cases in more than 70 countries. That was largely shut down with the help of vaccines and treatments in rich countries. But very few of those are available in Africa, and global health officials hope this new emergency declaration will kickstart an international effort to contain the disease.
Julian Tang is a virologist at the University of Leicester in the UK. I asked him to tell us more about the surge in Mpox cases and how this outbreak differs from the one 2 years ago.
The difference is really due to the different clades or strains, if you like, of this Mpox virus. The strain from 2 years ago was a global strain, and the clade 2, which is the so-called West African strain, and it proved to be much milder and more limited in terms of clinical severity than the original clade 1 virus. The one that's now spreading across Africa is a branch of the clade 1 virus, now termed clade 1b. And this is part of the original strain from the DRC, Democratic Republic of Congo. And this has a higher mortality, is more severe clinically, and may be increasing transmissibility compared to the original endemic clade 1a strain from DRC.
Talk to us more about this transmissibility, because this Mpox variant has now, this new strain has spread to 13 countries, the outbreak. Hundreds of people have died, mainly children. Why has this new variant been able to spread so quickly?
Yeah, so that's a good question. I think we're still looking into this, but the original strain from DRC, the clade 1a, if you like, was limited in terms of that it would only spread beyond maybe 3 or 4 generations, and then it would die out. And it's often transmitted from animal reservoirs in the original endemic area. Now it looks like the virus has adapted better to human transmission. Again, something we saw with COVID-19 after several years. But this virus has been around in Africa for many more years. We've known about it for over 50 or 60 years. So I suspect that more human cases, are allowing the virus to evolve and transmit more efficiently between humans. Again, like we saw with COVID-19 and the SARS-CoV-2 virus.
How much of a difference do you think it'll make that the WHO has now declared the Mpox outbreak to be a global public health emergency?
Oh, it should make a great difference. Normally these fakes, as we call them, PHEICs, tend to be announced when you want to release more funding and more resources to those particular epidemics or pandemic situations. And this should hopefully allow this release of funding and resources in those African countries, though of course they are already quite resource limited in many other ways.
Should people outside of the affected regions be worried about their own health? Could this virus end up spreading much further? And if so, what precautions should people be taking?
Yes, of course. As we saw 2 years ago, the clade 2 strain spread globally along the so-called MSM network, the men who have sex with men sexual network. But this is much more indiscriminate. It seems to be spreading across the heterosexual population and other general populations. It may be less transmissible than the clade 2b strain turned out to be, but again, we need more data on this. And the way it transmits is through intimate close contacts of saliva, kissing, touching with contaminated secretions. And also there's some evidence of close range aerosol transmission after a prolonged period of contact, like in a household, for example, or in an intimate relationship.
Right. Okay. Well, I'm afraid we're going to have to leave it there. Julian, thank you very much for talking with us. That was virologist Julian Tang at the University of Leicester.
The first case of a highly infectious Mpox variant has been detected in the UK for the first time in a person who returned from a holiday in one of the affected countries in Africa last week. The UK Health Security Agency says the patient is currently isolating at home under the care of the Royal Free Hospital in London. So how significant is this, and how great is the threat to the public health? Here's more from our health correspondent Dominic Hughes.
So Mpox, a disease that currently there are a number of different outbreaks in Central Africa, mainly based around the Democratic Republic of Congo, but also seen in Uganda, in Kenya, in Rwanda and Burundi. And it was one of these countries that this holidaymaker was visiting. Now, they returned to the UK, to London, at the beginning of last week. Within 24 hours, they fell ill, developing the distinctive rash, which is a symptom of Mpox. So you get this rash on your legs, your arms, your hands, your face, sometimes on your torso, and it's filled with, you get the rash is sort of pus-filled pustules. And then you can also develop flu-like symptoms. So they sought help at their local hospital at the Royal Free in London. They were quickly diagnosed that it was Mpox, and further tests were carried out to confirm that. They're currently isolating at home, and the UK Health Security Agency say they are in the business of tracing now some of those close contacts, so maybe around 10 people. They describe the risk to the general population in the UK as being very low. And they say that at the moment they have all the measures in place they need to contain this outbreak because the patient is isolating. And they don't think anyone else actually who was on the plane with that person when they returned from Africa, from the African country they were visiting at the beginning of last week, they don't think any of those people would have been exposed either.
First, I want to talk about Africa, which we've talked about a lot tonight. But by the end of the century, Africa is going to be home to 1 of every 3 young people on the planet. How does that inform your work and your investments?
Yeah, it's a huge challenge that the places where babies will be born are increasingly the toughest places in the world. You know, the number of babies being born has peaked and is going down slightly, but the portion that are born in Africa will go over the course of the century from about 22% today to about 50% by the end of the century. And that, you know, Africa today is only 1 billion of 7.3 billion people. So the fact that that's where half the children will be born by the end of the century speaks to this issue. And even within Africa, it's places like Niger, the north of Nigeria, where you'll still have a lot of kids being born. And so, you know, we have to help those governments get their primary education right, get all the things that we take for granted. Fortunately, some countries are graduating, you know, China, Brazil, Indonesia, even India, things are going well enough that they'll be able to support almost all of their own needs. And so Africa, it's primarily Africa with a few additional countries where all the foreign aid and philanthropy can focus in because of the success in most of Asia and Latin America with these very tough issues.
One of the things that surprised us when we got into this work, and I think is worth mentioning tonight, is that as you save these children's lives, that is, as Bill said, death rates of children under the age of 5 have been cut in half. There used to be this fear around the world that if you cut childhood death rate, then you would have massive overpopulation. But luckily, the converse is true, that parents in these low-income settings, they are making basically an insurance bet. They want to know that several of their children will survive till adulthood. So as they can see that their children survive, they actually will they want to bring down the number of kids that they have. But today there are still many, many places like northern Nigeria or Niger that you go, where if you sit in a village, and I've done this, and you sit and there's maybe 150 women, the men have gone back to the fields to work, and you stay and talk to the women and you say, how many of you know a woman who's lost a child in childbirth? Literally every single hand will go up. And then if you say, how many of you have lost a child in childbirth? You'll still see about 40% of the hands go up. So they've seen so much death with children, they're having a lot to make sure a few survive. And yet women will say to you over and over and over again, I want to have fewer children, but what happened? What happened to that clinic that used to have contraceptives for me? What happened to the fact that, okay, the clinic's still there, but there's no supply of what I want to use? And so one of the things that we have gotten deeply involved in is access to contraceptives, because 220 million women are telling us they want access. And so if families can, we know from great research and data in Bangladesh that if parents can bring down the number of children they have, their children are healthier, their children are better educated, and the family is wealthier. It is the greatest anti-poverty tool. And so if you think about why women, for instance, in the United States have the opportunity to work, it was the advent of the pill. And so we are quite determined to help women have access to the tools that they want around the world. And that will help with some of the population numbers in Africa, but that is not the reason to do it.
So I want to end with this question of a potential breakthrough that you see coming, whether it's something you're working on within the foundation or that you're just seeing generally that you're most hopeful and optimistic about?
Yeah, I have a lot that I could name. Just in the vaccine field alone, there's great hope that in the next 10 or 15 years we'd have a vaccine for tuberculosis and HIV and malaria, so the big killers. And that's why it's worth holding HIV in check until we get that tool that we can stop people from getting infected. In terms of the thing I'm most excited about, I'd go back to nutrition. The fact that 40% of the kids never have their body or brain fully developed, and that by solving that growth problem, having them have full growth, they will also survive even tough episodes of these diseases. That is so exciting, and it requires genetic sequencing, it requires big data, it requires all these tools that 10 years ago, the microbiome, which I wasn't the first to mention that. I always try not to use too many scientific words, but she said it first. The microbiome was opaque because the amount of sequencing and data processing you have to do to even understand what's going on. These are the bacteria growing in your gut. That's the single thing that I'm most excited about, and I see will be very likely in this decade to dramatically reduce malnutrition.
Melinda, anything to add to that?
Well, the thing that I think is imperative for the world, in addition, absolutely, the science which moves us forward, is we have to empower women and girls. And if you want to lift up societies, you empower and educate girls. And it starts in most of these countries with good health, because if you don't have decent health, you can't go on to get a great education. But the more and more and more I've seen, and the longer we've been in this work, is you lift up women and they're going to lift up everybody else, and you see it time and time again, and so we're quite dedicated to doing that as well.
Mto Sambang Juara.
Sambang Juara and her family live in Kirawan, a village on the north bank of the Gambia River. They are a family of griot storytellers.
Sasa me ya mutawala kata limoniati. Utuma besa karkiling anintilitan. Ngakam ne foka fondute. Nsafo no anyo onte na dinne wol kona. Hana manke wode dingi yawul adoni karu konon. Yawul tinga be kole yal ne material. Yo de nano je loko. Iman tangandir bla soto ala fafata. Omuni bizote.
After her daughter died, she volunteered her other children to be part of a pneumonia vaccine trial with the Medical Research Council in the Gambia.
Waka kendo nyame. Ngadindi ngome nko yalo ngadindi ndo etanaja. Ni tangata. Kankontani.
Midway through the trial, others in her village who had agreed to be in the trial began to drop out.
Wotondunda mol kanenke ya mankafo ko haninte bibi ninga mosoto. Yen ndingota yaduni emarsidoro mbedu ne katuna ko. Ndela din ndo fata le ni aja fata. Amanjara lo soto atumo.
Still, they were not convinced. So Sambang wrote a song that she and the other griots in the village performed to tell the village how important the vaccine was. The griots performed the song all around the Upper River district of the Gambia. Families came and listened. The griots' efforts worked, and the families stayed in the vaccine trial.
We have seen a dramatic reduction in invasive disease, pneumococcal disease, since then. The Gambian children are so well immunized. We're seeing more and more mothers come for immunization because they believe that vaccines are good for their children.
The Gambia Ministry of Health now ensures that every child in the Gambia is vaccinated against pneumococcal diseases when they are born. so that more children can go to school and more communities can thrive.
Ntalia okumani nena ntola adoto nkoni mo be bulo be mirankile ala ngani ulbe kaka kilinet ntala dimba ngani amene laftana dumba be ke kilin.
Every child should have equal chances of survival, and vaccines are one way we can do that.